Young people, particularly young key populations and their sex partners, make up a considerable proportion of the new HIV infections in the Asia and Pacific region. Young key populations frequently experience stigma and discrimination, often in the context of punitive laws, age of consent laws, and harsh social taboos. This makes it difficult to stay safe and healthy, and it heightens their exposure to HIV. Efforts to prevent HIV among young key populations are not yet adequate. Differentiated HIV services designed to cater to the specific needs of young key populations are still unevenly available. Despite these challenges, youth-led organizations are stepping up to bridge this gap. Let's hear the experience of Manuel from the Philippines.
As a young gay man, I have experienced discrimination that made me afraid of going to seek HIV services. But after finding Love Yourself, I am much more confident in my own health as I can easily obtain condoms without any judgment. Best of all, I use the online app Safe Spaces PH that helps me find condom distribution points near me.
Partnerships between government and community-led organizations, especially at the local level, are vital to bring about youth-friendly services. Communities also help to advocate against discriminatory laws. Thanks to their strong activism, law reforms have been done in countries like India, the Philippines, Thailand, and Vietnam. Despite the key role that they play, youth-led work is not sufficiently funded. Tell us more about the needs of youth-led organizations, Kim.
Youth-led organizations mostly rely on external funding. The youth programs will be under threat if resources continue to shrink. Youth Lead, the regional young key populations network, is empowering youth organizations to push for our priorities in national projects proposals and to diversify funding sources for sustainability.
We will not be able to end the AIDS epidemic in the region without putting young key populations first. Find out more about the situation of young key populations and the important actions to take in the new publication from UNAIDS, UNICEF, UNFPA, and Youth Lead, Putting Young Key Populations First.